And we're joined now by Amy Velez with the Marion County Health Department. And Amy, you're going to take us through the basic emergency kit that everybody should have in the event of an influenza outbreak. And we start out with what is really kind of the common sense things that you should have and things that you should stock up on, because the shelves will be bare. There could be runs on certain things. You just want to be prepared. Take us through it.
Yes, these are very important items. All of these are really non-perishable. These are things you can keep on hand and really stock up on. Of course, baby supplies, anything baby needs. Pet food is very important. I know a lot of times people, remember their family, but they really sometimes may forget their pet, so Of course don't do that. And just, basic things like batteries, flashlights.
Toilet paper, anything that you need, just the household supplies, things that you need to stock up on. Let's get into what I really consider kind of the meat and potatoes, or the heart and soul of this area, and that is things that have to do with disinfecting and hygiene, because that really is going to be the essence of controlling an outbreak of this kind.
Yes.
Take me through the essential things that you should have, why you should have them.
Hygiene is crucial at this time, very important. I think the most important thing we have here on the table is basic soap, bars of soap to wash your hands. It's recommended when you're washing your hands to sing a little song like the ABC song or Happy Birthday, just for 30 seconds to get a good lather and make sure you're getting those germs off. If soap and running water is not available, Germex or any of those alcohol-based gel sanitizers work very well. We also want to think about surfaces, and you can come in contact with germs through hard surfaces such as kitchen countertops or doorknobs. So we want to wipe those down and use the Clorox-based wipes. If you don't have those available, just general bleach would be a really good thing to use. And you can dilute that and put it in a spray bottle.
Then I see other things here, paper towels, trash bags. The key here is disposable.
Again, just because of what we're dealing with the virus, we want to get that out of our homes and throw those away. So disposable paper towels, tissues, put it in the garbage bag and take it out of your house. Very important.
And I know in any flu season, in my house and most houses, you got to have lots of tissues, and I would imagine that's something that's going to be in short supply if you don't stock up ahead of time.
Again, something you can stock up on, and they're non-perishable, so get as many as you can now.
Okay. At the end of the line here, I see that you've got a portable radio, and I know during hurricane season, that's always recommended, but we're dealing with something here that is really a serious emergency situation. Portable radio, very important for getting messages out to the public. Tell me the importance of that.
Especially local radio, because support services will be available and those will be announced on the radio. Again, you don't want to go out during this time, so it's better to stay inside, stay in tune with TV or radio, and you can hear about the support services that may be available.
Okay, we're on to the second section of this emergency kit that everybody should have, and this is dealing with canned goods, non-perishable foods, and fluids. Quickly take us through the things that we need to have.
Okay, again, baby items, your typical things you would have, your formula, baby foods, canned goods for the older kids, raviolis, and don't forget to have a can opener on hand. That's very important, to have a manual can opener.
Yeah, it doesn't work without the can opener.
No, it doesn't.
Yeah, and canned goods last forever. Good thing to stock up on ahead of time.
Right.
Okay. Let's get into the centerpiece of this, and that's fluids, both water and, of course, electrolyte based sports drinks. Talk about the importance of these two things.
Yes, these are very crucial. Staying hydrated when one is ill is very, very important, and especially the electrolyte solutions, because if someone has vomiting or diarrhea, this is good for fluid replacement. And of course, just basic water is very important to have on hand as well. And stock up on it. You can buy it by the case, keep it in your garage.
Can't have too much of it in the house.
Can't have too much water.
Okay, so very, very important. We go down to the last section here, and we're talking about some high energy foods, but also some very bland foods that are very important when you have an upset stomach.
Right, just bland foods like crackers, saltines are very good when you don't feel like eating a lot, when you're ill. Some high protein type foods such as nuts and fruits, dried fruits. Again, these things you can keep on your shelf for quite a while and they won't go bad. So things you can stock up on very easily.
Okay, so now we get to the third part of this medical kit that everybody should have in their home, and these are your basic medical supplies, everything from generic things to very specific prescription things. Take us through it.
Sure. Basically, during influenza outbreaks, we want to have supportive therapies on hand, just trying to keep the people comfortable, looking at sore throat, pain relievers, fever reducers, Theraflu type medications would be very important. For your children too, you want to make sure you have things for the kids because they are specific.
Okay. And again, in a time like this, a lot of people will be looking for these medications, so it's good to have them ahead of time.
Good to stock up now.
Okay, then we get into the idea, and this kind of goes back to hygiene a little bit, and that is the idea of controlling the spread of the virus while you're caring for somebody. Obviously, you're going to need a thermometer, but some other things that might go along with it.
Sure, the thermometer is very important. You want to be checking the temperature regularly to ensure it's not increasing. This could be a good sign to seek further medical attention if the fever does not go down.
Now, we have a couple of things here with surgical gloves. That's also a good idea when you're disposing of paper towels, things like that, anything to have a barrier between you and where there may be
Sure.
some type of germ. And then also, when we talk about these masks, with regard to what you would wear as the caregiver, there's some specifics here you need to talk to your healthcare provider.
Yes, a lot of times these types of masks are used in the healthcare setting, and they're really to protect the healthcare worker from the virus. These other types of masks we can use for the patient in keeping that virus contained just to them, and they can be disposed of as well.
So good to talk to a healthcare professional to know what's the right mask for the right situation. And then we get down here, and this is a little bit of common sense. If you're taking prescription medication, make sure you're prepared in a situation like this.
Sure, especially those with chronic diseases such as diabetics or people with high blood pressure. You want to make sure you have your glucometer available to keep checking your blood sugar, because that can change when you're ill. It can fluctuate. And also just regular prescription medications. Keep them stocked up, but also keep a written prescription out so you can get to the pharmacy and get those medications as you need them.
And I see we also have vitamins on the table, but I know depending on what medications you're taking, that may or may not be appropriate, so you want to talk to your doctor.
Yes, you need to consult with your physician.
Now, it's important that we're all prepared to handle a wide variety of situations. In addition to an emergency kit, there's another very basic concept that is key to controlling a pandemic, and that is basic hygiene. In fact, experts agree the single most important thing we can do to control the spread of a virus is to wash our hands. It may seem overly simple, but it could save your life.
It spreads by droplet, by coughing, sneezing. It can even spread, if you cough in your hand and go to shake somebody's hand, it spreads that way as well.
Washing your hands. The Centers for Disease Control says hand washing is the single most important way to prevent the spread of illness. But it's critical to understand that proper hand washing is more than simple soap and water.
Adequate hand hygiene actually requires friction to occur for up to 15 seconds. You know, that whole your mother taught you sing happy birthday, itsy bitsy spider. That holds true in proper hand hygiene. You want to make sure that you wash and rub the hands completely with soap and water, that you remove any rings or washes, that you wash up to your wrist, and that you thoroughly rinse and dry your hands.
If you don't have access to clean water and soap, you can use hand gels. Look for the ones with isopropyl or ethanol alcohol. Apply liberally and rub hands together vigorously for up to 15 seconds. Whenever possible, protect your hands from coming in contact with germs.
If you have access to using gloves, probably for handling like used tissues, bedding that might have been soiled, much better practice if you can use gloves. But if you can't, and if it's in your own household, you may not have access to that type of equipment, you still want to remember to wash your hands after handling those products.
When it comes to surfaces, the CDC recommends a solution of 1 part household bleach to 10 parts water. Spray the solution on the surface and let it sit for 5 minutes before wiping clean. Other household chores can be taken care of with just a little common sense.
You need to wash the dishes in warm, soapy water or in the dishwasher. That's fine. You don't need to do anything special with that. Laundry can be done with everybody else's laundry. It's not something that has to be separated. But you don't want to carry it close to your chest. You know, you want to bundle it, like wrap the sheets up around it and then hold it out. Don't be holding it up to your face. And always wash your hands as soon as you're done caring, whatever care you're doing for that person.
When dealing with a person who's ill, a mask is always a good option, but you need to be specific.